on the drug seller's prescription. And during our study, we found that we encountered so many sick sheep and goat animals showing clinical signs suggestive of PPR in the markets and abattoir. Services for small ruminants were able to say that sheep and goat rearers tend to consult butchers and sell off their sick animals instead of consulting veterinary doctors in the study area. Another thing we found out in that study was there was non-availability of the homologous PPR vaccine at the time of visit in the veterinary establishment and outlets in the study area. And they listed so many complaints. The chief complaints were that of lack of demand, inadequate power to preserve this vaccine, that's maintaining the cold chain, and expiration of the vaccine. Among the respondents, that's veterinary doctors, only 10% of them actually had the vaccine at a time, which based on these three reasons, they stopped stocking up these vaccines. So we look at the risk factors. Based on our findings, lack of awareness of PPR vaccination among the small ruminant farmers, limited use of veterinary services by sheep and goat rearers, non-availability of homologous PPR vaccine at veterinary establishments, and most importantly, taking sick sheep and goat to the market for sales are the potential risk factors of PPR prevalence in Enugu State. The implications of these findings. One, poor consultation of veterinarians by farmers will lead to poor management of this disease and also delay or lack of treatment. This will in turn create room for further contamination of the environment, thus encouraging spread of this disease. Also, the practice of taking sick animals to the market for sale provides a potential avenue for the spread of this disease to other animals from different households and communities, thus encouraging outbreaks of PPR. How will this happen? Remember, when these animals are being transported to the market, they are transported together with other susceptible animals, and they are kept together when they are being displayed in the market for sale as they await the buyers. And animals not sold and those bought are taken home to meet other flocks. We have to note here that PPR is actually transmitted via oral and spread readily when healthy and infected animals are kept in close contact. These are some of the pictures I took during that survey. If you look at how crowded they are, there is no how a particular one that is having PPR wouldn't distribute this disease, spread it among the rest here, which will now lead to the outbreak of this disease as they have been moved to other localities. So what are the next steps? The next steps to this, there is need for an extension program with stakeholders and farmers. Stakeholders and farmers need to be educated about this disease. They need to report suspected cases of PPR promptly to the veterinarians. They need to be sensitized on the importance and benefits of PPR vaccination. And also the need to use veterinary services. And most importantly, they need to be educated on the danger and implication of taking sick animals to the market for sale. On the part of the government needs to enforce restriction on animal movement at our borders. They need to enforce obligate vaccination of small ruminants and also enforce animal identification. Then the current control measures mapped out for this disease should be reassessed. This will serve as tools for effective planning of nationwide vaccination campaign for improved control of PPR in Enugu State and in the country at large. It is worth noting that the key to effective eradication of PPR is hidden in these three things: effective vaccination, good disease management, and timely veterinary intervention. Thank you for listening.
Thank you very much, Dr. Chukwudi, for this very good, it's a great presentation. quite fitting nicely with what was presented also by Dr. Shabiri just before. As I was saying, I still invite to have all the questions and discussions at the end of all the talks, because I think the same issues will all come together at the end concerning PPR. So so thank you again, Dr. Chukwudi, and we'll see you back at the discussion panel. So if you could stop sharing your presentation, I will